Hi, this is Dr. Bernstein's Diabetes University. Um, we recently had an annual scientific meeting of the American Diabetes Association. However, this year, 2020, it was a virtual meeting where many of the presentations were made from people's homes, and there were two clusters of presentations. One was a cluster of three debates on low carb diets and type 2 diabetes, and the other was two debates on type 1 diabetes. As it turned out, low carb diets. As it turned out, the three debaters on type 2 diabetes didn't really debate because they all agreed that low carb diets were essential for the treatment of type 2 diabetes. When it came to the type 1 debates, however, one speaker was a scientist who presented data in a scientific manner and was not of a mind to do battle. The other was a physician who treated diabetic children and was advocating a high carbohydrate diet and gave a list of pseudo-reasons for giving kids a lot of carbohydrate. The speaker who was advocating high carbohydrate diets, probably because it's much easier to give a kid a lot of fun foods, less effort for the physician. And when you don't know how to treat the disease to begin with, it's the easiest thing to do. So she gives a list of reasons to justify her high carbohydrate diets. So she makes the following claims. Deprives children of essential foods like grains and fruit. Well, grains are artificial foods, processed foods that came about when agriculture began. In different parts of the world, it started perhaps at different times, but let's say 10,000 years ago. Humanity evolved over hundreds of thousands of years, long before the availability of grains. And once grains became available, there was less starvation, but we also ended up with diseases like diabetes, heart disease, and so on. Grains are certainly not necessary for humans, and you can visit my video on YouTube where I chew a little bit of whole grain bread, spit it on a test strip for glucose, and the strip turns black, indicating that this little bit of whole grain bread turned virtually 100% into glucose. Low carb diets require dangerous amounts of saturated fats to maintain calories. Well, the low carb diet that we use doesn't require the addition of fat. We take whatever fat comes with the protein that we're getting, and we don't have to pile on fat. Now, on top of that, saturated fats have repeatedly been shown to be benign. In fact, just this month in the American Journal of Cardiology was an article devoted to the fact that saturated fats are benign and not harmful. It allows for red meat and cheese. Well, I've been eating red meat and cheese for, I guess, 86 years now, and my last coronary artery calcium score, which goes from, I think, 0 to 15,000, and mine was 1, and I can exercise at my theoretical maximum heart rate, which is 156 beats per minute, and I do this every week. Can cause eating disorders. Well, we know that carbohydrate craving is an addiction, and you start off kids early in life eating a lot of carbohydrate, they can certainly become addicted to it, as many in our population are, because that's just what we're doing with all our kids. You go into a supermarket, and what's up front is the cereals, the cakes, the cookies, all the things we're giving kids nowadays, the fruits, and we have all these fat people as adults because of carbohydrates. In addition, when it comes to psychological damage, we have the brain damage caused by high blood sugars caused by the high carbohydrates. This author claimed that all you have to do is take a lot of insulin to cover the carbohydrate and you'll be okay. But we know from experience that high doses of insulin combined with high carbohydrate leads to up-down blood sugars. They may average high, but they are varying wildly, and that both the high blood sugars and the wide variability are causing brain damage. And there have been probably dozens, if not hundreds, of studies of the damage to kids' brains caused by high blood sugars and diabetes. Then she's talking about inability to participate in birthday parties and celebrations. Well, if you start off a kid early enough with substitutes for the things they might get in birthday parties, it's not a big trauma. My pediatric patients know that their friends are getting fat and they're looking good, and they don't consider it a problem. She claims that low carbohydrate stunts growth. Well, studies done at Yale University showed that when kids have high blood sugars, they fall off the growth pad, the growth curve that they were previously on before they became diabetic, and that when you control their blood sugars, they return to the normal growth, their prior normal growth curve. So it's already been demonstrated by several studies that high blood sugars stunt growth, not low carbohydrate. She says that high carbohydrate causes dyslipidemia. And what we actually find in our studies is that the lipids that count when it comes to predicting heart disease, like lipoprotein small a, oxidized LDL, small dense LDL, triglycerides, all go down when they're on a low carb diet with normal blood sugars. And the HDL, which is believed to be protective, or the HDL subparticles that are protective, go up. Another claim is that it impairs cognition, and that again is a myth, because what's been demonstrated in the scientific literature is just the opposite, that many aspects of cognition are impaired by the high blood sugars, and these kids grow up with brains that on CT scans are smaller and defective. Can generate euglycemic diabetic ketoacidosis, which is utterly ridiculous. I've been on a low carbohydrate diet since probably 1971, and I've never had ketoacidosis of any kind. Causes hypoglycemia. Well, what we've seen in our studies is dramatic reduction in hypoglycemia because we now get patients with straight line blood sugars instead of the wildly varying blood sugars. And another claim is that injected glucagon will not work, which is only true if you have repeated hypoglycemic attacks that require the injection of glucagon so that you deplete your body of glycogen. The best way to restore glycogen in the liver and muscles is 24 hours of normal blood sugar. Whereas if you're having these wildly swinging blood sugars, you're not as likely to restore normal levels of glucagon, therefore of glycogen. So glucagon will not work. Glucagon works by converting glycogen to glucose if you have severe hypoglycemia. So just every point she makes is nonsense. And that's all I have to say. The list of claims that I just mentioned, interestingly, ignore the fact that high blood sugars cause the ultimate damage that diabetes causes. The blindness, the heart disease, the kidney disease, the brain damage, etc., and advocating, especially for children, high carbohydrates that cause high blood sugars is just dooming them to misery in their later years.